My name is Sarah Grace Young, and the country that I chose to research this semester is Brazil. Brazil is a country located in the central eastern part of South America. Brazil is the largest country in South America. In addition to being bordered by every South American country except Chile and Ecuador, it has approximately 4,500 miles of coastline along the Atlantic Ocean. Brazil is made up of several different regions which all have diverse climates. Northern and central Brazil receives frequent rainfall and experiences higher temperatures. Meanwhile, southern Brazil is characterized by a humid subtropical climate. The terrain of Brazil is mostly flat with rolling lowlands to the north. There are also some plains, hills, and mountains throughout the country that cover about 8.5 million square kilometers. The country has a population of about 217 million people. Brazil's government is a federal presidential constitutional republic based on representative democracy. Brazil operates under a universal healthcare coverage. Vector-borne diseases are present in many areas of Brazil. These types of infections are the leading causes of illness among travelers returning from South America. Diseases such as Zika, malaria, and yellow fever are the most prevalent, resulting in hundreds of thousands of infections each year. These infections create a high risk of birth defects to infants born to women infected during pregnancy. Heart disease is the leading cause of death in Brazil at 31% of all deaths. Ischemic heart disease and cerebrovascular disease are the leading causes of death. Heart disease is a main problem due to the large population that are smokers, as well as traditional foods that they eat. About 22% of Brazil's population is considered to be obese. Poor sanitation in overpopulated low-income communities known as favelas is a huge health risk. Along with poor sanitation in low-income communities, it is also reported that there are currently around 4 million people in Brazil who do not have access to safe water. There are about 24 million people who do not have proper sanitation conditions to live in. Poor sanitation also leads to the pollution of water, which is why so many people do not have access to clean water. Poor sanitation leads to the transmission of diseases such as polio and typhoid. The infant mortality rate is 11 deaths per 1,000 live births. The child mortality rate is 13 deaths per 1,000 live births, and the average life expectancy for a female is 80 and for a male is 73. Brazil adopted a universal healthcare system in 1988. It is known as the Unified Health System, or for short SUS. It provides health services to about 70% of the population. Since 1990, there has been a big expansion of this health system in efforts to reach universal health coverage, which they did achieve in 1988. Overall, the SUS increased healthcare access to a significant proportion of the population in Brazil. This healthcare system covers every person who is legally living in the country. The SUS offers many services free of charges, such as preventative services, primary care, outpatient care, inpatient care, maternity care, mental health services, pharmaceuticals, dental care, vision care, and physical therapy for residents and visitors, including undocumented individuals. Although seemingly Brazil has a good healthcare system, the largest concentration of doctors, hospitals, and healthcare services are located in urban areas. This creates a challenge for the rural and low-income populations. Of the 6,600 hospitals, about 63% of those are private, giving unequal access to the population. The SUS is funded by tax revenues and social contributions from federal and state governments. The Ministry of Health is responsible for the national coordination of SUS, including policy development, planning, financing, auditing, and control. State government duties include regional government coordination of strategic programs, and delivery of specialized services that have not been decentralized. The health departments largely handle the management of SUS at the local level, including co-financing, coordination of health programs, and delivering of health services. Brazil operates under a universal healthcare system while the United States operates under a public system provided by Medicare, Medicaid, military veterans, and state children's health insurance policies. The United States and Brazil's private healthcare systems are very similar. They are both made up of employer-sponsored health insurance as well as private companies. The United States has one of the highest costs of healthcare in the world. In 2020, U.S. healthcare spending reached $4.1 trillion, which averages $12,500 per person. According to the World Bank, Brazil spends about 9.59% of its GDP on healthcare. According to the World Bank, the United States spent 19.7% of its GDP on healthcare as of 2020. From hospitals to clinics to special practices, American healthcare is safer, more advanced, more accessible, and more specialized than Brazil. Brazilians are heavily reliant on their Catholic faith. They have many holidays and social gatherings that are centered around their religion. Their religion is reflected through architecture all over the country. Because of their faith, they are more reliant on the treatment of an illness rather than preventing disease. They are also very reliant on at-home remedies for treatment such as herbal medications. Brazilian culture is all about togetherness with friends and loved ones. They participate in many different social gatherings such as Carnival, which is one of the most popular ones. They gather together and eat traditional Brazilian foods, and much of their culture is centered around gatherings involving food. It is also very normal for personal space to not be respected. This directly relates to health due to the fact that unhealthy eating leads to obesity. Since their culture is centered around gatherings and eatings, it is fair to say that there is a direct correlation between the foods they eat and obesity. Also, being very close regarding personal space, shaking hands and hugging leads to the spreading of germs and infections as well. Brazil has very poor wealth distribution. About 33 million Brazilians are currently in famine, and 63 million are below the World Bank poverty threshold. Most wealthy people in Brazil are concentrated in large cities. Brazil's minimum wage is below the country's livable wage in all categories such as single adults and typical families. The minimum wage in Brazil is currently 998 reals. The livable wage for a single adult is 1,020 reals to 1,450 reals. The livable wage for a typical family is 1,770 to 2,650 reals. This would explain why Brazil has such a large amount of poverty. In order to improve health in Brazil, there are several things that can be done. The issue of poverty needs to be addressed. The favela communities in large cities have grown due to migration into cities. Healthcare and equal opportunities are lacking in rural areas, forcing many people to move to cities. Since 1990, the population of low-income communities in cities has increased to 35%. To address this issue, it needs to be a priority to address poverty in the cities by creating more jobs and livable conditions. To prevent the growth of low-income communities, it will be important to create equal opportunities outside of the cities for healthcare and jobs. Improving sanitation is a major way to improve health. Cleaning up the city and creating a sanitary environment for people to live would help cut down on spreading of infections. Improving accessibility in rural areas will keep people from moving to cities and will help to prevent overcrowding. This will also help to distribute the wealth. Creating and promoting vaccinations will help to address the country's problem with vector-borne diseases. This will help prevent infants from being infected in the womb, and requiring vaccines for foreign travelers will also help to cut down on international infections as well. The person that I chose to interview is Margaret Salisbury. Margaret is one of my cousin's closest friends. She grew up right down the road from my family and me, and we used to hang out when we were younger. Margaret took part in a foreign exchange program in high school and lived for a year in Brazil. She lived in a city called Aracaju. During the interview, she told me that Brazil has very poor sanitation, especially in the cities. The city where she lived was not a major city, but she was able to visit Rio and said that there is a large homeless population and very poor sanitation in the streets. She also mentioned how she noticed there was so much overcrowding in urban areas, which leads to the issues of homelessness and poor sanitation. I was curious to know if she was able to have access to health care while she lived there, and since Brazil operates under a universal healthcare system, she was able to receive basic health care just like everyone else. She said that there are major differences in healthcare in comparison to the United States. She said that the quality of care seems to be a lot poorer, and even getting an appointment to see a doctor is difficult. Coming from the U.S., she stated that she was used to receiving good quality of care and was always able to see her primary care doctor with no problem whenever she needed to. One of the main issues that she sees from her own personal experience is the quality of care that people are receiving. Quality and access to care were her two main concerns when it comes to the healthcare system in Brazil. Major issues affecting Brazil are high poverty, poor sanitation, and unequal distribution of healthcare. Addressing these issues will be the key to improving health in Brazil. As we have previously learned, all of these issues continue to get worse as the years go on. Brazil has a very strong culture which plays into their healthcare system. They are very reliant on family and friends and enjoy spending time with one another. They are big into their Catholic faith, which plays into the healthcare as they rely more on treatment rather than prevention. Brazil has a universal healthcare system which provides primary care to all, but since there is an unequal distribution of healthcare, it makes it very hard for everyone to have the same opportunity to get the care they need. The recommendations made are some great ways that Brazil can start to improve their health status. These are the references that I've used for this assignment.